Hello folks, my name is Dr. Charlotte McEwen and I'm a cardiac surgery resident here at McMaster University in Hamilton, Ontario. I'm delighted to be this year's recipient of the Trainee Excellence in Education Award, and I'd like to take this opportunity to recognize and thank several of the teams that I've worked with over the past few years on these major projects. Firstly, you may already know that I'm the co-chair of the Trainee Program Planning Committee here at CCS. This is a 45-person committee that brings together leaders in education from across the country to deliver 20 sessions by trainees for trainees at the Canadian Cardiovascular Congress. And this year we're hosting 96 expert speakers covering topics from the horizon of education and research to connecting trainees with mentors to hands-on simulation training that's very difficult when we're spread across the country in small groups, but possible when we come together at the Canadian Cardiovascular Congress. Locally at McMaster, I'm responsible for delivering and supporting gold standard interprofessional team training for cardiac arrest care in our cardiovascular intensive care unit's mock code training program. McMaster University and Hamilton Health Sciences is very proud to be one of 3 accredited CSU ALS, so Cardiac Surgery Unit, Advanced Life Support Centers of Excellence in Canada. And that means we offer this course on a quarterly basis to our staff, but also colleagues from other centers who don't have a locally accredited program. And if your center is not CSU ALS accredited or you'd like to send team members to be trained, I know that we are happy to welcome them to McMaster for these training courses. So please feel free to be in touch. Further, this year at Hamilton Health Sciences, we've developed our Code ECMO eCPR program. And I'm very proud to say that's been an interdisciplinary process, which is to say we have leaders involved from perfusion, cardiac critical care, interventional cardiology, cardiac surgery, respiratory therapy, trainees of all levels, management and leadership, as well as really every member of the interprofessional team that engages with these patients. And I was involved in developing the policy documents, our consensus documents, but also in supporting and leading 23 sim-based team training sessions that we delivered locally before the full launch of the protocol so that our teams could be ready when it finally came time to fully enact this protocol locally. My medical education research here at MAC is supported by my supervisor, Dr. Matt Sibold, who you know to be an interventional cardiologist and a medical education scientist here at McMaster. Our work was supported by the Robert Maudsley Fellowship for Studies in Medical Education from the College of Physicians and Surgeons of Canada, as well as a grant from the Canadian Institutes of Health Research. And I'd also like to take a moment and thank the SIM training teams at Northwestern University, the Center for Medical Simulation at Harvard, as well as the Health Science Education Program here at McMaster University, who've supported my development as a medical education researcher and a simulation expert. Finally, I've been privileged to work with the Canadian Society of Cardiac Surgeons in the CSCS Task Force for Education. This is a 36-person team who are working on the hardest problems in surgical education, developing shared resources, exploring solutions, and building training opportunities that reach across the country. And that includes the minimally invasive mitral valve course that was delivered this last year in Alberta, but also the interprofessional team training for cardiopulmonary bypass disasters at the Beyond Boundaries conference in Quebec this past spring. If you're a trainee or faculty that's interested in surgical education and you have a bit of bandwidth for surgical education projects, this is a group that would be happy to welcome you. I have one last thought for you, which is that education and innovation in education is hard and serious work, critical to the future of our specialties, but also necessary to maintain excellent patient care. And to all of the surgeons across the country who make time and spend energy on surgical education and on the training of your surgical trainees, I'd like to say thank you on behalf of my colleagues, but also on behalf of their future patients, who are our neighbors, our friends, and our loved ones. Surgical education is important. I'm honored to be the recipient of this award this year, and in turn I recognize surgical educators and education scientists across the country who are working hard on these challenging problems. Thank you very much, and I look forward to seeing you at the Canadian Cardiovascular Congress this year.